Our case series are the first 6 cases of an ongoing randomized controlled trial on the effects of the introduction of a cardboard baby box in the promotion of safe infant sleep practices in a suburban community of Santo Domingo, Ecuador. The baby box is a simple design cardboard bassinet that has been used as an innovative intervention to decrease bed sharing and promote back to sleep and other safe infant sleep practices around the world, including the United States. A study from Temple University Hospital in 2016 showed that the use of baby boxes, along with face-to-face education, reduced the rate of bed sharing by 25% in all infants in the first week of life, and by 50% for exclusively breastfed infants. In Santo Domingo, Ecuador, staff from a local health center affiliated to the University of Kentucky has reported high proportion of bed sharing in unsafe positions to sleep. It is believed by the staff that these practices are associated to cultural tradition and lack of availability of bassinets and poverty. The objectives for this case series are, first, to assess the participants' prenatal intentions on bed sharing and infant position to sleep during their third trimester of pregnancy, and second, to assess the participants' behaviors on bed sharing, infant position to sleep, in use of baby box as infant sleeping surface at 1 month and 6 months postpartum. We recruited 6 pregnant women during their third trimester of pregnancy who were receiving medical care at the Centro Médico Hombro a Hombro. Once the participants signed the consent form, they answered a survey about infant sleep intentions. After the survey, a trained nurse educated them on safe infant sleep practices and provided them with a cardboard baby box with infant supplies. Instructions of how to use the baby box as a sleeping surface for their infants and baby box safety recommendations were also given to the participants. Once the babies were born, the participants received home visits by a trained community lay health worker at 1 month and 6 months postpartum. At the 1 month home visit, safe infant sleep recommendations were reviewed again. At both visits, the participants fill out surveys about their infant sleep practices and the community lay health worker fill out an observation questionnaire. Regarding our population, 3 participants were primiparous and 3 participants were multiparous. The mean participant age was 23.5 years. Their ages ranged between 15 and 31. The primiparous were younger, 15, 19, and 24, and the multiparous were 24, 28, and 31 years old. When asked about their ethnicity, all of them self-identified as mixed race or mestizo. 2 of the participants had elementary school education. 4 of them had finished or almost finished high school. Their average family income was less than 1 minimum wage per month, and their income covered less than their basic needs. All participants were married or had a stable partner, and all participants expressed their intention to breastfeed prenatally and were breastfeeding at 1 month and 6 months postpartum home visits. This figure illustrates prenatal bed sharing intentions, bed sharing practices, and baby box use at 1 month and 6 months postpartum. We can see in this graphic that 5 out of 6 participants intended to bed share at their prenatal survey, all of the multiparous and 2 of the primiparous. Only 1 of the primiparous did not intend to bed share. Among the reasons why they intended to bed share, they stated that bed sharing facilitates breastfeeding and caring for their babies at night. At 1 month, 5 of the participants were bed sharing at night. Just 1 of the multiparous was using the baby box as a sleeping surface for her baby at night. At her pre-intervention survey, this participant said she intended to bed share because she did not have enough room. During the day, 3 of the 6 mothers were using the baby box as a sleeping surface, 2 multiparous and 1 primiparous. The participant who used the box at night also used it during the day. The mothers who did not use the baby box as a sleeping surface for their babies felt that the box was unsafe. At 6 months, all of the participants were bed sharing during the day and night. The mothers who used the box earlier said their infant fit under 3 months of age, and after that they needed to put the babies to sleep on their beds. Regarding our second variable, infant position to sleep, 4 of the 6 participants said they intended to place their babies to sleep on their side and 1 on prone position. They say these positions would be more comfortable for their baby or would avoid choking in case of vomiting. Just one participant intended to place her baby on his back. This was the same participant, a multiparous, that used the baby box during the day and night. She said back to sleep was safer for her baby. At 1 month, 4 of the 6 mothers placed their infants back to sleep, 2 on their side. And at 6 months, all infants were placed on their back to sleep. After the review of this case series, we can conclude that first, there is a high prevalence of unsafe infant sleep practices among this population, including bed sharing and prone and side positions to sleep. Second, that the baby box does not appear to change bed sharing at night, but it seems to be an option to place the babies to sleep during the day for napping. Third, that the baby box dimensions inhibited its use beyond 3 months. And fourth, the interventions demonstrated a positive trend towards affecting placing the infant on their back to sleep. Currently, it is uncertain which intervention can be attributed to this behavior change, the safe infant sleep education, or the provision of the baby box, or both. Our ongoing randomized control trial aims to distinguish between the effectiveness of safe sleep education and the provision of the baby box in decreasing high-risk sleep practices, including bed sharing and prone and side positions to sleep. This outcome will guide the development of strategies to promote safe infant sleep practices in this community and in similar at-risk communities. This study is possible for the collaboration between the University of Kentucky and Universidad de San Francisco, Quito, Ecuador. We want to give special thanks to the Hombro a Hombro Centro Médico staff and Shoulder to Shoulder Foundation for their collaboration in participants' recruitment and data collection. Thank you for taking the time to view our presentation. Please feel free to leave comments. We would love to hear from you.